So we used to not be able to really even get past here.
Right.
It's great now because we're starting to kind of play with these new ranges. Last week we had kind of a flare-up of this cording here, so we couldn't go too crazy with it. But this first release that we've been doing, nice and relaxed right there, good, is coracobrachialis. Alright, so two things in this video that aren't necessarily explained are cording and frozen shoulder. So cording, or axillary web syndrome, the axilla is basically our armpit. What will happen is after breast cancer surgery or treatments, they'll remove the lymph nodes underneath the armpit, and that will lead to kind of this cording or this web, which is basically a stiffening of the connective tissue there. And so that will make it really hard to go overhead. So that was our initial problem, is we were being restricted by this cording, but then later on, once we got through that, we started noticing that it was a little bit deeper. So that's why we think it is adhesive capsulitis, which is basically a thickening of this tissue in the shoulder capsule. We call that frozen shoulder. And so what happens is if there's an area of inactivity, so she wasn't able to get PT after her procedures due to COVID, we get really locked up, and that can be kind of an onset of frozen shoulder. So I hope you liked the video. Also, thank you for 1,000 subscribers. If you want to see more videos like this, make sure to subscribe. I try to post about twice per week.
I feel like the cording is better.
Okay, and I'll just do like a quick little review of what we've been doing.
Yeah.
So we just had a mastectomy here, and that stented into
Radiation, yeah.
the radiation there, and then having that break with COVID, she wasn't able to have PT, and so we're thinking that that may have caused the start of her frozen shoulder.
Yeah.
So when she first came in to see me, she could only lift her arm about here.
Yeah.
We've gained about 45 degrees pretty quickly, which is pretty exciting.
Yeah.
And now we're working with a limitation. It's called cording, which is where kind of the nerves come down and are actually the limiter versus any type of muscle. So you can kind of see that if you want to come in a little bit closer, right in through here. So it's not necessarily anything that we can blast through with adjustments or soft tissue. However, we are able to do some releases through here and open up her capsule and make her more comfortable to start to gain into that range of motion. So right now we're doing some laser therapy with her and some releases, and then she's doing a ton of rehab and stuff on her own at home, which is making sure that we don't lose anything that we've gained so far.
Yeah.
So anything more that you want to say to that?
No, I mean, and I definitely feel like the laser has helped with my scar tissue for sure, and has helped quite a bit with my range of motion.
Great.
Yeah.
So we'll get into that. I'll have you go ahead and go into your back. We've kind of got the routine down now. Cool, and if you want to just come in real quick. And then we can just clip it from here. We're not going to show the full. Got the cinematic view. Perfect. So we used to not be able to really even get past here.
Right.
It's great now because we're starting to kind of play with these new ranges. Last week we had kind of a flare-up of this cording here, so we couldn't go too crazy with it. But this first release that we've been doing, nice and relaxed right there, good, is coracobrachialis, which is going to be a big limiter in our abduction, as well as flexion with the shoulder. So I'm doing okay with that pressure there?
Yeah.
Okay. Yeah, it's been really fun just kind of seeing the week-to-week progress with it. We've had little setbacks, maybe about twice with the exercises.
Yeah.
But yeah, other than that. you've gotten used to all of this stuff. It used to, I feel like, be a lot more painful too. So.
Yeah, and in fact, this feels good. It's not painful at all.
That's great. Great. And then we move into a Pec Major Release, just kind of a generalized release here. And taking the arm back, doing okay with that there. But we do have to be kind of conscious and careful that we're not playing too much into that cording, because that can set us back a little bit. You doing okay with those?
Yeah. Yeah.
Nice relax there. They're like the easiest adjustments ever. If you want to come around here. Okay, so then we get our adjustments in, and we come back to the shoulder to finish up some posterior capsule work, which helps her build up or help her get into further internal rotation, which is some of the rehab that we have her doing at home. Next one, pretty good?
Mm-hmm.
Let's go ahead and flip onto your stomach. Yeah, come in super close. Awesome. Big breath. All the way out. And then one more here. Big breath. All the way out. And then let's sit up and we'll face that doorway. Alright. Get that shoulder release. And these are becoming much easier when we can get them to move, but we're not forcing through anything. We had that explosion one day.
I know. Oh, rocked my world.
Her first big shoulder adjustment was scared me a little bit.
I bet it
I
did.
couldn't show you the fright. So this is our capsule release into the posterior capsule. We're going to take that across. Yeah, I don't think I've heard a louder shoulder adjustment, but
Really?
it's up there on the charts.
I think I screamed pretty loud.
Definitely scared the next patient in the
Yeah.
waiting
They probably left.
room. Awesome. This also used to be extremely tender for you.
Right.
but
Yeah.
You're doing really, really well with this. Good. I'll get one more little pass through there. Doing okay?
Yeah. Feels good.
Sorry, I'm being a little extra mean to you today.
No, it's okay.
Good. And then we always hit our levator scapulae, which is this muscle through here, because she gets just this overuse compensation. It's not necessarily directly related to what we're working on, but it feels really good. Go ahead, take the chin down to your chest, and the chin over to the right, and then we can pull that arm across. Good. Just the feel good stuff is nice sometimes.
Right.
Let's come on back. guys have any tennis or
We did every Sunday.
Every Sunday?
Until the weather
Is that the family
changes.
outing?
Yep.
That's awesome.
I think it was the best one yet.
Yeah.
Yeah.
It was.
It was super nice this weekend.
So nice.
That's kind of a nice family event.
It's so great.
Alright. I was going to ask if you're doing it this week. Let's go ahead and just tape up the shoulder here.
Okay.
You like that? Usually?
Yeah.
Perfect. Do you have a color preference? We'd have to do pink to get your...
Yeah, no pink, because it reminds me of breast cancer.
Alright. Maybe tell me about that.
Black is good.
Yeah. That's a good mix. Oh yeah, I was telling you about the...
Oh yeah, that expo thing? That.
Yeah, Rock Tape gave us a ton of pink tape.
So the Peloton offers, they now have new bar classes,
Okay.
which is like, stretching and core and so fun.
Yeah.
We've all been doing it.
Mhm.
Yeah.
That's kind of nice. Is that your favorite class that you do?
So far, yeah, other than the cycling.
And you're what, a 2-a-dayer? Plus your rehab?
I would if my husband wasn't working where the bike is.
She's pushing 3 a day.
No. I get mad because now everybody's using it.
Yeah.
It's like, it's my bike.
And actually, I forgot to scrape you today. Let me do that first.
Are you sure? Do you have time?
Yeah, totally. We're good. I've got your appointments pretty dialed in. Let's go into your back real quick. When the camera is rolling, I kind of tend to forget everything that I know.
I was gonna say something, but I didn't want to throw
You
you
didn't
off.
want to make me look bad. Yeah, so we usually scrape just this whole open angle side pretty gently, but just to ensure that we don't miss anything. This kind of helps as a nice little muscle reset for everything else. And you like this as well.
I do love it.
It's like there's something missing. That's okay there on the
Yep.
in there.
Yeah.
Now we can take it. If you want to look to the right, I'm going to spray this. Guess that's not as bad as the biofreeze getting sprayed up in the air. Now you can sit on up and get that taping button. Bring the arm out here. Cool.
Feels good.
Awesome. Sweet. And that's how it goes. Thanks for watching. If you enjoyed the video, do me a huge favor and smash that like button below. And if you want to see more videos like that, go ahead and subscribe. My face button right there if you don't want to miss out.